I am back with a new video. I know it's been a long time since I last updated, and that's just because I hadn't really had anything to show you guys. So that was that reason. So let's go ahead and get into the update. I am currently in my last term of my program, so I only have 10 weeks left. Yay, I'm excited to be done. Some other exciting news, I got hired at the hospital that I was doing my clinicals at for an RT student position. If you're currently in a respiratory program, definitely ask if they have RT student positions. From what another preceptor told me, she did the same thing whenever she was, if you're in a respiratory program, look and see if your clinicals offer RT student positions, because I think that is actually really great to put on your resume, because you have clinical resume, then you have like job experience resume, and that job experience will get you more job opportunities once you get your license. So definitely look into that. From what another preceptor told me, because she had just graduated in May, was that whenever she could do floor therapy, she made like a certain amount of money, but then once she got to like ICU, then she could go up again. Typically what a RT student does is help out with first rounds, EKGs, and stocking. And that's what they did at her hospital. That's what they do at my hospital. My hours are 7 p.m. to 11 p.m. You can stay late. And I think there's three of us, and only one of us works each day. So we're gonna rotate out. And of course you get your shift differentials for nights. And definitely do that and get your experience. I started on the 28th and it's been going great. I did a 12-hour day shift. And then on Tuesday, I'm gonna go to my regular night shifts to get my training and everything. So I'm excited about that. Make a little bit of money. I'm gonna show you some things that I got for Christmas, because my dad's really good friend is an RT at a hospital that I'm going to apply to when I graduate, and they both want me some really great things that as a new grad and a student I feel like we need. So I'm gonna show you guys that one. All right, so one of the things I got for Christmas was a clipboard, and this is a respiratory clipboard. It folds out. You put your sheets right here, because whenever you work, if you haven't done your clinicals or anything yet, you're going to get a printout of your assignment. And then you just put it on here, because you're going to write down like your stuff. Because sometimes some hospitals do not have a cow, and you might have to try it in the room. Or if you're too busy because you have a lot of assignments, you're going to basically jot down everything on your assignment sheet and then go try it later. The other side is just more information. These are your different types of masks, how many flow can go with it, ABGs, PFTs, let me see what's at the bottom, more PFT information. And then on here you have your lungs, and then you have volumes that you'll see on your ventilators. And then you have your weaning protocols down here. So it's actually really helpful, and I really, really loved it. And I was gonna get me something like this, but she beat me to the punch. So these are my goggles that my school gave us. At the hospital, they just updated it and said these are no longer allowed. They want the full face shields, which I don't have any here, but they want the full face shields. These are not allowed anymore. This little bad boy is a N95 mask holder. So you just pop these open right here. Our school gave us these. I did not order these. And then, boop, put your N95 mask here, because use one per shift. And then you're gonna need a pulse ox. Everybody needs a pulse ox. Clean it between each use of your patients. Turn it on, and then you just place it on the finger. It's gonna give you the heart rate and the pulse reading, and then that automatically goes off. This beautiful boy, I got this for Christmas, is a stethoscope holder. So let's open it. If y'all can't tell, my favorite color is literally blue. So they got everything blue for me. These are my pens. I bought these. These are on sale for $3, because you're going to write. A lot of RTs like to use colored pens. You're going to write these down, because you're going to need this like information. You're going to be writing a lot. So these are good. These do not bleed through. They write like pens. Like, they're really great. But they're like, let me see, Papermint. Let's see. There we go. Papermate. So I like these. You need highlighters because you're going to highlight, you know, what type of treatment that they're getting. And then here's my stethoscope, which I got for Christmas. This is a Letman Classic 3. Like I said, blue's my favorite color. Letman. And then I didn't even notice this, but let's see if I can find it. She had it engraved with my nickname, Kiki. Last name counts. But yes, I like the black color instead of the silver. Excuse me. But this is everything that I feel like you need. I'll probably get more once I start working. And there's some other things that like I have. Excuse my junkiness. That's like we have these little things for dry eraser markers because we don't have to update the whiteboard, but we have these signs. Whenever you give an aerosol treatment, you need to put, people can go in 45 minutes after without an N95 mask on because we're treating everybody as if they had COVID. Alcohol swabs, huge, important. You want to always have these because you're going to want to clean your stuff in between each patient. Extension tubing, you're going to place your O2 tubing on these bad boys. And then you have your Christmas tree. Always carry these around because they're not always in the room, and then you're going to walk around the whole hospital trying to figure out where they are. So just keep some extra ones on you. But these are all the little goodies that I have for working right now. Once I start getting my new job, I'll get more things and I'll do a new video of everything else that's in my backpack. So what's been going on in the program is I had my ICU in 230. I finished with an A, and I had my NICU PD 240. I finished with an A as well. Guys, it's not impossible to make A's in this program. Mind you, I do have an 18-month-old kid that I take care of and go to school. So it's not impossible. You gotta work hard, but it's not impossible. What else has been going on? I'm trying to think. So this term, we've been online. We only went on campus one time for like 4 hours to do our lab. So now we will be on campus since it's our final term. We're gonna I have clinicals on Mondays, and then I'm on campus Tuesday, Wednesday, and Thursday, and I have Fridays off. Y'all, my campus is like 30 miles from me, so about like 35 to 40 minutes away, not including traffic. So I'm not excited to drive there at all. So we're on campus, and she said she wanted us on campus because so it's our last term, and she wants us on there so we can do a lot of practice tests. Basically, this whole term is getting us ready for the boards. We're gonna do a seminar on how to take the boards and how to pass. We are gonna be using Kettering this term. We're gonna have the book, and then we're gonna have the workbook to do homeworks and stuff out of it, and then we're gonna be doing a lot of practice tests for the ClinSims and the TMC as well. So that's what's going to be happening this term. Let me know what you guys want to see, because I don't know what you want to see. I don't feel like I'm going to have like a lot of content coming out, so I won't be updating as much. I've seen that I had a lot of new subscribers. Thank you guys for the love. My older stuff was like, why did I choose respiratory therapy? I'm gonna do a new version of that because that video is really long, and I don't even really think I just did a great job explaining why I chose that field. So I'm gonna redo a video about that. But if there's something that you guys want to know or more information about, let me know and I can definitely do that. One thing, the COVID vaccinations, because I'm hired at this hospital, I can get that vaccine. They're currently out right now, and they're about to get the second rounds because it's a 2-round vaccine. So when I get the second rounds, the people who need their second are going to come in, but they're going to send out an email so the people who haven't gotten it yet can get the shot. And I'm going to go ahead and do that because, one, I have a baby. And so since I'm an employee, I am going to get it because I will be working with COVID patients, and I have a baby at home, so I'm just not going to risk it. As a student, we weren't allowed to go into COVID rooms, so I wasn't necessarily like, really too scared of it. But now, since I actually work there, I will be going into those rooms. So it's like, all right, let's protect myself and my baby. So that's what we're gonna do. I don't think there's much else for me to tell you guys, except that it's almost over and I'm super excited. I think once I graduate and actually start working, there might be some better content that comes out, like, you know, how to prepare for an interview, what to do as a new grad. You know, my child in the background, sorry. And all that stuff. So that is what I'm gonna do. Thanks to you guys for your support, and